Hello everyone. Today we are talking about the intrauterine contraceptive device. So what is the intrauterine contraceptive device? It's a device inserted into the uterine cavity to avoid the unwanted pregnancy. So what are the indications? Who can use copper T? So it is used as a spacing method. It is best used for the spacing method where the couple has got one child and they want to defer the birth of the second child at least for 2 to 3 years. It is a very good method. So for them that is the first choice. They can use the intrauterine contraceptive device. That is usually it is called as a copper T device. Okay, so it is also advised for the long-term contraception. People who don't want to who are not planning for the pregnancy for 5 years or 6 years. So long-term contraception also is offered with this intrauterine contraceptive device. And nowadays, even for the unmarried people who are having regularly sexual activity, but they are not planning for the pregnancy as of now, even for them who have not delivered one child also, but they want long-term contraception, like if they're because of the profession or if they're studying or and they're pursuing any course abroad or they're settling in abroad later. So for them also who want long-term contraception but never had a child, for them also it's a very good contraceptive method. And for the couple who have already got one child but they want to defer the second child for 3 to 4 years or 5 years, for them also it's a better contraceptive device, or it is a better contraception method when compared to the other contraceptive methods. Okay, so what are the benefits of contraceptive device? This contraceptive device. So this is a one-time procedure. So the device will be inserted once and that will stay for 5 years. And if the couple wants to plan for the pregnancy in another 3 to 4 years, or just even after 1 year also, if they think okay they can plan for the second baby, then also it is very easy to remove. The insertion procedure is also very easy to perform. It takes hardly 3 to 5 minutes for the procedure for the insertion of the device inside the uterus. And definitely it is painless. Almost it is painless. Mild discomfort can be there, but otherwise it is most of the times it is painless. And no need of any additional device like ultrasound or anything. It is very easy to do. It can be done in a clinic also. So it is very easy to perform, and the cost is also very less for the insertion, and the copper T device cost is also very less when compared to other contraceptive methods like tablet pills or the injectable contraceptives or any other thing. This is cost effective method also. And what are the other advantage when you compare the copper T device with the other contraceptives? It is like you need not remember it every day, like in case of pills, where the female has to take the pill every day almost at the same time. If she forgets for one day, she needs to take the 2 tablets the next day. So those things will not be there in copper T. It is only inserted once and you can forget it for 2 to 3 years or till when you plan for the pregnancy, or till the copper T what kind of copper T is inserted, whether it is inserted for 3 years or it is inserted for 5 years. Even there is one more copper T which comes for 10 years also. Okay, so for such long period it can be retained insert and no need to remember whether it is there, or like pills, it is not like that. Okay, and one more thing is the failure rate when compared to the failure rate for other contraceptive methods like condoms or the tablets or any other injectable contraceptives. So when failure rates are compared, the copper T like intrauterine devices, they give better success. Means the failure rate is very less when compared to other modes of contraception. Like in condoms and barriers, it is almost 4 to 5%. And in pills also, there is a significant fertility, like there is significant failure rate is there, like 1% like that. And in copper T, it is very negligible. Even there can be failure, can happen even with intrauterine device also, but it is very less when compared to other contraceptive methods. And compared to the fertility the return of fertility, like that is once the couple removes the copper T, they're planning for the next baby, or whenever they want pregnancy, that time after removal of the copper T, the return of the fertility is faster when compared to other methods. Like for example, pills. The pills might take 1 or 2 months, sometimes 3 months also for the return of fertility. But copper T is like an inert material. It is a metal. It is a copper coated to the teat-shaped device or the loop-shaped device. So the copper content is inert. It doesn't exert any hormonal actions on the body. So once it is removed, the contraceptive effect of the device will be removed immediately. Okay, and also it is used as an emergency contraceptive whenever there is an unprotected intercourse. Like instead of taking I-pill or anything, the copper T is a safer option because again it offers the long-term benefits. It is not having any hormonal side effects as compared to I-pill, and it definitely gives protection against unwanted pregnancy. And one more thing is, there is no interruptions in the menstrual cycle. For example, I said like there can be a failure rate even with copper T, but though it is very less, but there can be a failure even with the copper T. But then it is very easy to recognize, or it is very easy to diagnose a pregnancy if the periods are missed, because copper T doesn't alter the menstrual cycles. Copper T per se, it doesn't alter the menstrual cycle because it is inert. So there will be regular menstrual cycles with copper T. So if the female misses her period, then definitely she can check the pregnancy test, and it's very easily detectable. Unlike injectable contraceptives where the periods are very much irregular, there can be a withdrawal bleeding, there can be a breakthrough bleeding. So many things are there where the female gets confused whether there is really pregnancy or not. But like in copper T, it is not like that. It is once the female misses the period, then definitely she can check with just a urine pregnancy test, and if it is really positive, it is very easily and early recognized. You can visit to the gynecologist, and they will take care further. Whether you want to continue or not, they will advise further actions to be done. And this is all about a copper T. There is something else like a hormonal IUCD, which offers a better contraception when compared to the normal copper T, and it doesn't have other side effects also. But regarding the hormonal IUCD, what we call it is popularly it was called as Mirena. Now other devices also have come for a hormonal IUCD. But regarding that information, I will talk to you in the next video. And do you have any other doubt regarding this copper T, or you want further more information regarding the hormonal IUCD, you can please ask us. We are all the time happy to give the information regarding all this. Thank you.